I'd like to start just by thanking Dr. Ammering and the organizers of this conference for the opportunity to speak here and to introduce the WHO's QualityRights E-Training initiative on mental health, recovery and community inclusion. We are seeing an enormous impact in those countries that have adopted the QualityRights E-Training. So we very much hope that by the end of this meeting that you'll all be enthusiastic to roll out the e-training and advocate for its adoption and implementation at national and local levels. Before I go into the specific details about the QualityRights E-Training, it's important to provide broader context about where the e-training is sitting as part of the overall WHO Quality Rights initiative. Quality Rights is WHO's global initiative to improve the quality of care in mental health services and also to promote the human rights of persons with mental health conditions, psychosocial, intellectual, and cognitive disabilities. And as part of the initiative, we're working in 4 main areas. So the first you can see listed on the slide is to build capacity to combat stigma and discrimination and to promote human rights and recovery. We've still got a long way to go in achieving this objective and really ensuring that everyone has a firm understanding of what is human rights and what is the recovery approach. The second area is around supporting people with lived experience and civil society actors to fully and effectively participate in all aspects of decision-making related to mental health. We see there is a shift over time towards that happening, but still we also see at the same time that it's a bit of a sort of like tends not to be so meaningful in terms of the participation of people. And the third main area of action is around creating community-based services and supports that promote inclusion and that respect people's rights. And finally, we're working to reform national policies and laws in line with the international human rights standards, including the Convention on the Rights of Persons with Disabilities. So these are all aspects of the work that you may wish to learn more about. And I'm just putting up a slide here, which shows a wide range of training and guidance materials that we have developed or which are under development to support implementation in these areas. They have been translated into a wide variety of languages, but not yet in German. So you can see we have some capacity building tools and we have the links so you can access these, the quality rights training and guidance materials. These are training materials to use in face-to-face training, in-person workshops. They are all self-explanatory with the complete guidance you need to, and presentations and talking points to actually run the training workshops. And then we have the Quality Rights E-Training in mental health recovery and community inclusion, which will be the focus of the remainder of my presentation. Then you'll see on the bottom left-hand corner some resources around creating rights-based community mental health services. So we launched a couple of years ago now new guidance and technical packages on rights-based, person-centered, recovery-oriented community mental health services. And in this guidance and technical packages, we've featured a range of good practices from around the world. So good practice crisis services, peer support services, hospital services, supported living services, community mental health services, and other services that fall into the full spectrum of categories that you would have in a country. And I think what came out from all this guidance, it was quite clear that it is possible to develop rights-based, person-centered, recovery-oriented community mental health services. It is possible to develop that, but we need to bring those types of services so they become the mainstream of the system rather than remaining on the periphery. And the other important point is that these services can be running actually at the same or less cost than our traditional services that we're offering. Then we have a couple of practical tools in this domain of rights-based community services, practical tools to help assess and transform existing services into ones that are promoting rights, recovery, and person-centered approaches. So we have a lot of tools available now to make this dream happen. Then moving over to the right-hand side in terms of participation and promoting participation, strengthening participation, we have guidance, one-to-one peer support, guidance on peer support groups, guidance to help set up and support civil society organizations, as well as develop advocacy campaigns that are promoting not only improved awareness of mental health and the need to increase, investment and resources and services, but making sure that all of that is streamlined with a human rights-based approach. Last category, policy and law reform. We have developed in collaboration with the Office for the High Commissioner of Human Rights, new guidance on mental health, human rights and law. This, I'm glad to say now, will be launched on October 9, just a few weeks away. We'll be sending out communication on that probably starting next week. And we have new guidance under development on mental health policy and strategic action plans with a very strong emphasis on the human rights-based approach, engaging lived experience and addressing the social and structural determinants of mental health, of course, as well as addressing all the mental health service and system issues that would be more traditionally addressed in policy and strategic action plans. So it's a really exciting time, we feel, lots of changes, lots of enthusiasm, and really practical tools to make a difference in this field. I've also highlighted our Quality Rights Country Implementation Portable because it has a lot of examples of what countries are doing at the moment. Okay, so that's the background, that's the context. I'm going to move now to the e-training program. So the Quality Rights E-Training on mental health recovery and community inclusion was launched at global level by our WHO Director General, Dr. Tedros, alongside Dr. Michelle Bachelet, the former UN High Commissioner for Human Rights, as well as several ministers of health from different countries and other high-level representatives just last year in 2022. The overall aim of the e-training is to build capacity and change mindsets and practices to end stigma and discrimination and to promote human rights-based approach in mental health. And more specifically, though, just getting into more of the detail, it can help learners to understand and improve their own mental health and well-being, better support friends, family, and members of the community who are experiencing mental health difficulties. It can help people gain the knowledge and skills to tackle stigma, discrimination, abuses, and coercive practices. Learn how to provide mental health support to people as they recover from a physical health or mental health condition or crisis, and gain the skills to actively involve people in their own treatment and care, providing tools and empowering them to overcome physical and mental health challenges, as well as gaining valuable expertise and skills to transform a service towards a person-centered rights-based recovery approach. So I think it's really important to understand the breadth of this training program because it gives you an idea of the wide variety of stakeholder groups who can benefit from doing the training. So it's for people in the mental health sector, but it's also for general health nurses and doctors and it's a psychiatrist, it's people from outside the health sector as well, people in the community, people with lived experience, the police, people working in the prison system, human rights advocates, people in the justice sector. So it's basically for all the different stakeholder groups who are coming into contact with people with mental health conditions or need to have a better understanding and orientation around mental health. Because the Quality Rights E-training can be completed online at people's own pace. We have the potential to implement capacity building on a massive scale, allowing us to reach, engage, and train hundreds of thousands of people within and across countries. This is really unique. And we can do this at much lower cost and in a much shorter period of time than through face-to-face training alone. It doesn't discount face-to-face training. Face-to-face training allows much more engagement and deeper exploration of issues. But, you can see the potential of combining the two approaches. The e-training is currently available in 11 languages: English, French, Spanish, Armenian, Bosnian, Czech, Estonian, Filipino, Italian, Polish, Turkish, Ukrainian, and Croatian. We are planning a launch in Ukrainian in the second half of October. And then there are other languages coming too that are really at the last stages, Slovenian, Portuguese, Lithuanian. So that's very exciting. The number of languages is expanding, and then hopefully the impact we have is also expanding. This course has been designed to be an interactive, dynamic learning experience with different types of learning materials like short videos, information sheets, and discussion forums. And basically, we have a short sort of like overview video to give you an idea of what the e-training looks like. So let's take a deeper look. Well, I hope you enjoyed the overview. It's certainly, we have a lot of only positive feedback about the e-training and how people are really engaged in it. So let's take a deeper look at the content of the e-training platform itself. It covers 6 core modules and 2 advanced case study modules. The first module on human rights provides a very general introduction to human rights. It provides information about violations more generally and how that can affect diverse groups. Also, it can show how stigma and discrimination can contribute to the denial of human rights, which has direct negative impacts on mental health, and present some actions that can be taken to defend human rights. The second module goes through the different models of disability. It helps people understand the different ways in which disability has been defined and understood. It explores the stigma, stereotypes, discrimination, and other violations in mental health specifically. And it also introduces the UN Convention on the Rights of Persons with Disabilities. There is another module specifically on legal capacity and the importance of the right to make decisions, and that this right must be respected for all people. It also helps the learners understand how supported decision-making, recovery plans, and advance plans can be used to help avoid coercive practices and ensure people are able to exercise their right to legal capacity. On the right-hand side, you see the module on ending coercion, violence, and abuse. So this has a particular focus on concrete strategies to end these practices, and also introduces information about the need for reporting and complaints mechanisms and how they need to be incorporated in the services to ensure that services are free from coercion. There's also, for both these modules, an in-depth case analysis attached to each. Then we have quality services, community inclusion, and mental health, well-being and recovery. For services and community inclusion, we discuss the key services that need to be met in the services. It highlights the importance of deinstitutionalization and community inclusion, and how it's really important role of mental health services is to link people to other services and supports in the community, education, housing, employment, and many others. Then mental health recovery and well-being, it explores the right to health and how good mental health and well-being are important aspects of the SDGs. It also explores what recovery means, why it's important to adopt a recovery approach in services, and what actions can be taken to promote recovery. So this is the example of the certificate that people receive once they've completed the e-training. Many countries are introducing the e-training into their continuing professional development scheme, so that's been really positive. On this slide is some feedback that is typical of what we're receiving from people who are doing the e-training, some qualitative feedback. A lot of people are saying it's life-changing. They loved every bit of it. It was quite clear from the qualitative feedback that people's mindsets and practices had really transformed. And if you access the training platform, you're able to look at all the feedback that people have been provided, because it's all up there for each of the modules and in general. So basically, where do we stand? 100,000 people have enrolled, 50,000 people have completed the course. We've had a huge impact. We've a paper which basically is being accepted for publication, highly significant changes on pre-post-test evaluation, 40% improvement. That's massive, rarely reported. The potential is huge. If we train 5 million people, we have the potential to improve the lives of 500 million people experiencing mental health challenges. Can't take you through that in detail, but the slides will be available after. There are many benefits for all the different stakeholders, for policymakers. Policies are going to be formulated better, health and social care providers providing better treatment, care and support, NGOs, OPDs, community organizations, better support marginalized individuals and groups, families, carers, supporters, people with lived experience, learning about rights, being able to support themselves and other people, being able to contribute to policy making, and so on. And that brings me to the end of my presentation. This is a link to the e-training. I hope you all go to that and access it, and then spread it widely through your professional and personal networks and be part of this movement. Thank you very much. I stop sharing now.